get the information out there and let people know about integrative medicine.
Speaking about research, there's been, Leslie said, there's really more and more research, and good research. It's coming out all the time about acupuncture and Chinese medicine. And this article is actually a literature review of pediatric acupuncture studies that have come out. So if you are an acupuncturist and you're doing pediatrics, it'd be good to familiarize yourself with that. And that's the language you want to be speaking to doctors if you're trying to network and trying to really integrate what you're doing with the medical field. That's, I think, the language you want to be able to speak. And the more research that comes out, the more acceptance there is from the medical community, and the more physicians will come up to me and speak to me as if there's really something to talk about, because there's evidence. There's an evidence base for what we do, and I think that's just an important thing to remember if you want to be integrative and really work in that environment.
One of the other things is, frankly, some of the, sorry Jim, old doctors from 20, 30 years ago are also very uncomfortable with evidence-based medicine. And so it's a whole trend for the whole medical community. It's not just a bar or a hoop that you have to jump through. All of medicine, especially with the Comparative Effectiveness Council, is having to go through this hoop. And I think it's going to be better medicine in general. You know, there's no more because I said so medicine.
Mm-hmm.
And that's just kind of the old mentality, and you're being swept up in that wave, which is a good thing.
My thought, I mean, it's a little outside the box, or it may not be, but is providing the acupuncture for the physicians. I mean, I don't know if you guys, you know, yeah, you know, I mean, because that's the best way for them to actually truly experience the benefits, you know, and then once they start to experience the benefits, then they can start integrating it a little bit more, because what they don't know until they start to experience it and understand it.
Especially for referrals. I mean, how do they know what cases to send out to an acupuncturist
Exactly.
that they've never experienced it, have no idea what it can do?
Yeah, yeah.
And that actually was, when we got started at Children's Hospital, that was part of our program, was to provide acupuncture treatments for the physicians and the staff. And we had one or two physicians come in.
I got here too late.
Yes. We got there too late because the hospital decided that was not a good idea anymore, because it was a very popular thing, and a lot of the nurses were coming in and not getting time off to come in and get acupuncture. And so they got in trouble with their supervisors. So it's a little too popular, but it definitely is a good way to educate folks and get people to really see firsthand what this is about, and that that wasn't too scary and didn't hurt.
Yeah.
You know, we're doing pediatrics. A lot of times we'll put a needle in one of the parents so they can see what that is like, and so that the child can watch this happen to the parent and see that, no, that's not a terrible thing. Maybe I'll give that a shot. So that's also part of, I think, integrating our approach is really that's part of educating the parents, is to show them that, you know, the tickle machine doesn't hurt and the needles don't hurt too bad. So.
Yeah, and it's really about creating bridges, you know, how we can connect more to the physicians, and seeing how we're all similar people. We all want the same things. We all want to see, you know, our patients improve and be healthier. So figuring out how we can collaborate through experience.
And we're all working on the same bodies.
Yeah, yeah.
Yeah, I mean, the patient should really be in the center of this whole picture. I think it should be patient-centered and empowering for the patients. And it should help to empower us as providers to know what other resources we have for the patient.
Great. Well, one question we got in, and it's I think it's kind of a hot topic in general, but how does your medicine or your practice, how does your medicine treat autism? And do you see an integrative approach? And maybe that's more of a discussion between panelists. But anyone want to?
We treat it with acupuncture and herbs.
Like, I guess, okay, really, Erin? Surprise. But is there, you know, like,
Can you tell
what can you share from your medicine? Like, how do they see autism?
I don't really treat autism, but I'm very open to diet, and I think there have been some really good dietary things. The problem is the parents, it's a really hard diet to do.
What diet is it?
It's no dairy and no wheat, I think.
Gluten-free.
Gluten-free. And
it's such a broad spectrum of disorders, and it's really got to be treated, each kid that comes in has to be seen as an individual, and we treat what we see. And you guys that are doing Chinese medicine, you treat what you see.
What are the different things that you see? Because I just.
Well, you can treat, if a kid's coming in with a lot of digestive problems, we would probably focus on that. You can focus on the developmental aspects of autism, or on even like in Chinese medicine, there's a concept of the Shen or the spirit, and if they're really, pulled inward and they're not making contact with other people, we can try to treat that aspect of things. If the child seems very anxious or just not comfortable, we can treat that. So it's really just assessing what is it that's bothering this child, and trying to do the best you can with that. That being said, it can be a very difficult thing to treat, and we can make improvements, and it's really going to be individually based on how that child responds. But I think we can be definitely a part of the picture in the treatment of autism, and I think I would want to make sure that this child had access to occupational therapy and had access to a physician, and had it would definitely be an integrative approach, I think, to care at that point. But I certainly think we have a lot to offer. And we also have a lot to offer the parents. So, having an autistic child can be a very stressful thing for the parents, which can then be like a vicious circle kind of a thing. So, if you're taking the family approach and you notice mom and dad are stressed and not sleeping, and as you said, if you can treat the parents, a lot of times you'll see things change with the child, and at least you're giving them, the extra energy or whatever it is they need to deal with some of this stuff. So I think it's like a global approach, and it's hard to answer that question without, you can come to the pediatrics class, in like 3 weeks we'll talk about autism. The whole spiel, but that's in general. Wait, do you work with kids with autism very much?
Just a couple of cases, but I would agree there's such a tremendous range in development in the autistic spectrum disorders that you kind of have to take it case by case, I would think.
Go ahead.
As a parent of a formerly autistic child, and she's now nearly 23 years old, I agree with a lot of what you said, but my reason for coming here tonight was to see what integrative in your minds meant, and that is, how outside the box and what integrated, and it was because when I sold my last business, I created, and that's my background, is business, nothing to, but I've spent 24 years in investigating this challenge, and everything you say is correct, but it's so much broader than that. And there's so many incredible possibilities out there. Bit by bit, you take one step forward. If Danny, you've got a lot more time to be frustrated than I have. And as you see a child age, you get more and more frustrated. And my daughter still has challenges, but not, she's outside the autistic spectrum. But what I came here to see was whether integrative medicine in your mind
Can you
meant,
speak up a little bit? The people in the
Sorry.
back can't hear.
whether integrative medicine in your minds meant substituting a different type of treatment for drugs or for surgery or for chemo or thing. Because in my mind, that is never going to work because it's still treating symptoms. And I overheard somebody mentioning in the room over there, mentioning EFT and different things which are German new medicine and a lot of other things which intrigued me. And the reason when I sold my last business, I started a charity in order to promote this type of stuff. So unfortunately, there have been a few detours that I have to deal with along the way, so I've done very little with it. But one of the things I'd like to warn people like Danny or other people who want to really, and you mentioned there, and all of you have touched on it, is the very scary possibility of just substituting a needle for a drug or substituting a back manipulation for a drug.